Thank you very much to our speakers. And so I'm going to start with Honorable Minister Tabia Maulid. Thank you for joining us here today. How are you doing?
Fine, thank you.
I'm glad you're fine. And we are very interested to hear from you on what is in place in Zanzibar to ensure that young people access sexual and reproductive health rights services to avoid the pandemic of teenage pregnancies.
Okay, thank you so much, everyone. Thank you, Madam Moderator. Thank you, all participants, First Lady of the United Republic of Rwanda, senior government officials, representatives of, from UN, all organizers and sponsors, all youth representatives, and all ministers who represent youth in different African countries. Good afternoon. Nawasalimu kwa Jamhuri ya Muungano wa Tanzania. Kazi iendelee. Thank you. It is clear that to all of us, there is a direct link between sexual reproductive health and also mental health. And I'm sure most of us here will agree with me that young people in the continent are facing many challenges, including child marriage, teenage pregnancies, HIV and STI infections, gender-based violence, domestic violence, and other issues that lead to the young generation to face psychological problems. But as you said, let me go direct to your question, to what extent Zanzibar or Tanzania are trying their best to acknowledge, first of all, that there is a need for the young people to have sexual reproductive health, and also the importance of young people to be educated in most areas where they can be able to stand by themselves, to defend themselves, and to make sure that by using different youth agencies and development partners, those young people can be able to create their chances to employ themselves and not depending on the employment of the government, so that they can be mentally active and finally being economic well. In Zanzibar, first of all, we are having a structure of 3 areas so that we make sure young people can get the social reproductive health education. And first of all, it is starting in family stage. Those family members are required to provide awareness at home, which means family members to sit down with their children, and give them the education on how to prevent themselves against the global changing, social changing, cultural changes, and so many things that surround that young generation. But also, second stage, in our country, we involve those cultural sectors, like, for example, spiritually, some elders from the different community in Zanzibar, so that they can provide the curriculum and the sessions for young people to educate them about the importance of sexual reproductive health, spiritually and culturally. And the third stage is in the government itself, where we have ministries like my ministry. We have tried our best, first of all, to improve youth policy, where those young people get the opportunity to contribute on what to be done so that social reproductive health can be taught in many sectors. Like nowadays, from 10 years, we start in upper primary school, secondary school, to teach all students about the importance of sexual reproductive health, about how to prevent themselves from early pregnancies and other calamities like HIV and and other things. So in Zanzibar, I can say also we have Youth National Council, where young people can have the opportunity to sit down and express the ideas to the government on what to be done so that they can be prevented with their nation. So thank you very much for now. Let me give you that explanation, but without forgetting, let me take this opportunity to thank and appreciate and recognize high contribution from our development partners. UNFPA, UNDP, UNICEF are helping us a lot in our government so that we can proceed with helping those young people in sexual reproductive health. Thank you so much.
Thank you very much, Honorable Minister Tabia Maulid. Indeed, there is hope. There is hope for the young people, for the adolescents in Zanzibar, in Tanzania, and in Africa and beyond. And so, hi, Dr. Christelle.
Hi.
How are you doing?
I'm doing well.
An important strategy when working for young people is to do so with young people themselves. Can you share with us any ideas on how to facilitate young people's access to sexual and reproductive health rights as an innovator?
Thank you so much, Sister Lauren. So I want to first start by appreciating and also being sincerely grateful. It's such an honor for me to stand here and be part of this panel discussion. As a young person, as a young lady, and also as a young sexual and reproductive health activist and advocate. And I also want to take this opportunity to give my reconciliation and also be thankful for the First Lady of the Republic of Rwanda, Jeannette Kagame. She's one of my biggest role models, and I truly admire her. And it's because of how she believes in young people, and especially girls. And through Imbuto Foundation as the chairperson, together with Imbuto Foundation partners, they always find ways to empower girls and to empower young people and believe that we have skills and potential. So I'm grateful and thankful as well. So responding to you, Sister Lauren, so one of the ideas is actually starting with us, young people. So as a fresh graduate in medical school, I can really testimony about that. And then one of the ways is actually investing in broader range of innovations and technology. At Urukundo Initiative, following UNFPA recommendation, that sexuality education can be provided through games and role plays, we came up with Urukundo Life Skill Board Game, which was a game that we created throughout Innovation Accelerator Program brought by Imbuto Foundation, and that's where we started. And the young people in the room, I'm telling you, that was the first door which opened for us. And our game became an award-winning game. It was users tested, and with the help and the support of the government, it got validated. It got at doorsteps of many families and schools, and it helps to create that bond between parents and children, and also improve parents and children communication on big matters of sexual reproductive health and mental health. And trust me, those issues are like myths and taboos, and not only in Rwanda, but also in the African continent. And through that innovation, we're able to see that young people have innovations, and they have skills and potentials to deliver. All they have to be given to is an opportunity to express themselves and explore those potentials. And through different many programs, like the Innovation Accelerator Program, young people in Rwanda are given that opportunity. And it's seen that in schools, as Honorable said, comprehensive sexuality education is there, but I welcome young people in the room to think about innovations and educative tools that can be used, because they open up a platform to interact on such matters. And I would also like to take this opportunity to thank UNFPA Rwanda, Koika Rwanda, and the Ministry of Youth, Sport and Culture of Rwanda, because they supported different programs which are also brought by Mbuto Foundation in order for young people like me to stand here and testimony how preventive health is as far much important as curative health. And I'm telling you out of experience, I'm a fresh graduate medical doctor, and I'm telling you investments are required in all fields. Thank you.
Thank you very much, Christelle. Indeed, we cannot progress, we cannot accelerate the Sustainable Development Goals, and especially sexual and reproductive health rights, without innovation. To Honorable Emma Kantema, we are honored to have you here today. And we are honored to have you here today and for you to share the work that the government of Namibia is focusing on to ensure that young people are not only empowered economically, but also healthily. Would you please give us a few examples of what is in place in Namibia for that to happen, especially now that Namibia has started the Youth Connect Africa Namibia chapter?
Thank you very much for the opportunity. I bring you greetings from Namibia, the land of the brave. I'm pleased and excited to be here and listening to Her Excellency Ms. Janet Kagame speaking about what the Mbuto Foundation is doing. As a leader in the youth sector, I was filled with hope, knowing that, as Ms. Kagame has mentioned, no problem is left unattended. And I think she really deserves a round of applause. I would like to preamble my input in terms of what we are doing in Namibia by saying that sexual and reproductive health and economic issues are not mutually exclusive. And I'm very glad that Youth Connect Africa has identified sexual and reproductive health as one of the areas to focus on. In Namibia, we have elevated the issues of sexual and reproductive health as it's permitting through at a policy level, program level, and is also featuring prominently in our partnership activities, especially in terms of activities that we are being supported with by UNFPA, including other civic society. The National Youth Policy, of which our President, His Excellency Dr. Hage Geingob, spoke yesterday during the official opening, has a pillar that speaks and focuses specifically to youth and health. Now, in terms of this pillar, we have identified strategies how to achieve the objective, that of providing sexual and reproductive health. And so one of the issues that we identified to tackle, which is a problem, is the accessibility part. And in terms of how we ensure that we provide this very important service to the youth, as a ministry that's entrusted to empower the youth, in Namibia, we have what we call adolescent and youth-friendly clinics. These clinics are spread over the country. We have around 6 of the clinics that then offers and serves as a safe space for the youth to access sexual and reproductive information, including services. It's very key to mention that this service that we render also focuses on out-of-school youth, because we do know that, especially for the youth who are in school, there's comprehensive sexuality education that's being provided. So towards this end, as a ministry, we've also developed a comprehensive sexuality education manual that speaks to out-of-school youth. In terms of ensuring that the youth or adolescents, especially the girls, remain in school, the Ministry of Education, Arts and Culture have developed a pregnancy policy that falls under Education for All. Because as we are linking the health and economic opportunities, it's very important that we ensure that our girls remain in school, because it then increases their chances to be economically active and to be productive citizens. In addition to the youth-friendly clinics that we offer, at a program level, we have a program that we collaborate with the UNFPA, Safeguarding Young People. Again, this is an opportunity for us to ensure that we reach out to the young ones to provide the service, especially where we do not have the youth-friendly clinics. We then conduct the outreach mobile clinics together with our condomized activity. And to end also, I would like to mention that we collaborate with the Office of the First Lady under her program, the Be Free. And I'm happy to note that Her Excellency Ms. Kagame joined us. I think that was in 2020. She joined one of our sessions. These are sessions that we have for the youth at a non-judgmental platform, because we often hear that, adults are not speaking to the youth about it, and there's also that need to destigmatize sexual and reproductive health education. And lastly, I would like to mention that we've also gone a step ahead to ensure that sexual and reproductive health involve community. Because what we see, it's good and well, we can provide this information, we can provide the service, but when the youth go back in their community, the aunties right there, the uncles, will tell them, no, there's no need for birth control, there's no need for protection in terms of preventing HIV/AIDS and other STI spread. So we really need to also address the community involvement part. And thank you very much. And as Namibia, we continuously seek for ways to ensure that we empower the youth, not only economically, but holistically, because we believe that Africa relies on the youth of today. Thank you.
Thank you very much. Indeed, policies, programs, and partnerships are the way to go as we continue addressing sexual and reproductive health rights, mental health, and economic empowerment. And to Dr. Jean-Pierre, let's reflect on the young people's mental health. What is the current situation? And as we seek to promote mental well-being in young people, in your view, how can integrating mental health in sexual and reproductive health rights programs improve the health outcomes for the young people? Thank you.
Mental health. Mental health. What does come to your mind when you hear that word? Mental health. So the integration of the two, first consider this. What affects the brain affects the body. What affects mental health affects sexual and reproductive health. What affects sexual and reproductive health affects mental health. And I appreciate how speakers have brought those together and are starting to think. It is not starting, there has been a journey towards that, because there has been for too long a dualistic approach of thinking about mental health separated from physical health, thinking about mental health separated from sexual and reproductive health. And I think one of the reasons is probably that we have not been able to understand mental health as it is. Our understanding of mental health is related much with the stigma associated with it rather than what it is in reality. And I want to appreciate what has been done so far. Last time I was also honored to speak at CHOGM, and the topic for the day was rethinking mental health. And allow me to quote the words that were shared in that space. It's been many years since I have been a part of the mental health work, and I can feel the hope that I never had before when trying to advocate for mental health. When I said I want to quote and thank Her Excellency Mrs. Janet Kagame on her remarks on that day, on June 22nd, 2022. Part of what she said was, we are gathering under the reality that as we speak, according to WHO, 1/8 of the people we know, 1/8 of the people we love is affected by mental health problems. Now, as I'm going to repeat this text, this quote, I invite you to think of that one. When I say one, think about someone here in the room. Sometimes we think about mental health and we don't think about us, about ourselves. We think about hospitals and we think about some people that look in a certain way. But when, again, I invite you, when I read these, that one, when I say one, think about yourself. Actually, not someone else. Everyone here experiences stress. The only time you do not experience stress is after we say goodbye. When you are no longer with us, when I'm no longer with you, is when I will be free from stress. But I'm not talking about mental health disorders then. Not everyone has a mental health disorder. But we experience mental health disorders after a long accumulation of stress. It doesn't come overnight. Back to the quote. We are gathering under the reality that as we speak, according to the WHO, you, myself. It's about us. One. Let me repeat. We are gathering under the reality that as we speak, according to WHO, 1/8 of the people we know, 1/8 of the people we love. So if we have 1 out of a number of people around you, 1 out of the people you know, 1 out of the people in your family, in your classroom, your co-workers, people in the room on the same row. When we talk about mental health, we are talking about us. If I can ask, or something I have been observing in a clinical practice, When it comes to entrepreneurship, what does it require? Entrepreneurs. Tell someone else next to you one word of what it requires to be a good entrepreneur. All right. Ideas. Someone else? All right. All of those and more things that the people here are thinking. Can you have the ideas without mental health? How does that look like? I want to appreciate, as I finish the quote by Her Excellency Janet Kagame, I appreciate the work that has been done in this holistic approach of looking about mental health, not just as this is something that is here on the top, and this the rest of the body as if it is the transportation of the head. It is not true. That's why when we are thinking about mental health and those initiatives I've been observing with Imbuto Foundation and the others, when you want to think about businesses, entrepreneurship, it has to be with mental health. When you think about health, sexual and reproductive health, it's connected to mental health. But then what is the mental health? A few things, a part of it. We don't know yet what really mental health is, and I think we need to appreciate that. And the reason we know part of it is that mental health is what is helping us think. Why did you come here? Why did you come here? Mental health is what supports us to think. Thinking is mental health. Imagine yourself not being able to think. Those creative ideas you have because you have a good mental health. Mental health is about the feeling. Those feelings you have, the joy, the romantic relationship and how you express them, it's about mental health. If you didn't know how it contributes, then you will know when you see someone in a relationship and then the mental health isn't working well or they are stressed out, something is suffer. Mental health is how we react. The gesture I'm using, the choices you made, the clothes, these colors, the words I'm choosing to use and not the other one. That is the mental health. So when we stigmatize mental health, we stigmatize ourselves. We stigmatize our abilities. We stigmatize our potentials. And now thinking about connecting to sexual and reproductive health. What is it? Part of it, I'm not an expert on it compared to many others who, especially those who have been victims related to sexual and reproductive health. I believe that those with experiential knowledges are the experts of those experiences when it comes to that topic. But let me say a little thing. Sexual and reproductive health being about the freedom and the right to choose or to decide who you have sex with, how to avoid sexually transmitted diseases, how to avoid unintended pregnancies. So when then we get drunk, think about the definition of mental health. It's about how we think, we feel, we react, we make decisions. And I'm just talking about the thinking. The rest, there's also other factors. So when the mental health thinking, the feelings, the reactions, and decision-making is impaired, when you have a heightened stress, when you have a high level of stress, your capacity to judge, your capacity to make good decisions is impaired. The sexual violence, or maybe engaging in an unprotected sex, or even dark feelings. Talking about one of those issues we see is people feeling like they have lost everything and they have nothing to lose, so it's okay to have that unprotected sex. We see that in the clinical settings and in the outreach. So when it comes then to coping and working with these depressions, which we are seeing as the numbers have been shared, it's alarming on our continent. When it comes to depression, more than 100 million, as was shared. And the women being more vulnerable to the depression, now you can see the interconnection. More than 66 million among the 100 million in Africa, 66 million are women and in sub-Saharan Africa. So you can also connect to that. Subsistence abuse, subsistence use in Africa is also a big problem. And when you bring it together with depression, one is causing another and the other is making the other worse. And we are seeing alarming statistics like recent numbers of 42% of youth in sub-Saharan Africa. And a recent study showed that youth are engaging, among those who were surveyed, 42 were using drugs, any types of drugs, or that abuse those others, that's alcohol. When I say drugs, also allow me to say alcohol and other drugs, because it can be toxic itself. So as I conclude this conversation, if you are here, the self-knowledge is important for you to engage in a process of healing, knowing what you want, and allowing yourself to engage in a therapeutic process. Thank you.
Thank you. Thank you, Dr. Jean-Pierre. And last but not least, to Charles, all the way from Uganda. You are the chairperson of the National Youth Network called Afrian in Uganda. Please tell us why investing in young people's health is important also for economic growth in our countries and overall in our beautiful continent, in just a few minutes.
Thank you so much, moderator. I think the moderator is doing a good job. Can we clap for her? And she's still young. And thank you so much for the opportunity. I want to appreciate UNFPA Uganda for sponsoring my trip to this place. Rwanda is so beautiful, and I'm really comfortable here. Thank you so much for hosting us, Rwanda. I'm still as well happy that the majority of this congregation are young people, and whatever I'm going to be speaking is something to inspire you young people to be a voice and demand for your rights. Are you hearing me? You should demand for what belongs to you. So about 60% of the Africa's population are young people below the age of 25. If we are speaking about investing in young people, we are actually literally talking about investing in us, because we are the majority. The country I come from, Uganda, over 75% of the population is below the age of 30. That shows you how important we are, because we are the majority. And I'll tell you that if we invest in young people, we are not just investing in them, but we are also investing in the future. The young people are here for a longer time compared to the older generation. The skills we give them, they are going to live with them for a long time. Young people have a lot to lose as opposed to to the older generation. So there is a lot that we should do, and it is very important that we set key priorities around health. I want to share with you just some statistics, and this is very undesirable. And I'll use a case study of Uganda because I think I know Uganda better. But it's just a representation of so many other countries in Africa. When you are walking in Uganda, if you pass 4 young children, young girls below the age of 19, if you pass 4 of them, one of them is either pregnant or she has a child. What does that mean? It means that 25% of that age bracket, they are young mothers or they are pregnant. So there was a study that was done by UNFPA Uganda, and it says that if the current teenage pregnancy rate is reduced from 25% to just 10%, actually even 10% is still big. It's still big. But if it's reduced to that, about half of the health care expenditure for teenage mothers will be saved. Half of the health care expenditure for teenage mothers will be saved, equivalent to 169 million US dollars. Annually, more than 181 million US dollars will be spent by government of Uganda on health care for the teen mothers and the education of their children every year. That's how much Uganda will be spending, 181 million US dollars. So what does that tell us? It tells us there is a lot we should do to ensure that these girls, and actually also boys, because it's a girl doesn't get pregnant by herself. It's either me or him who will do it, who will impregnate her. So it's important for us to invest in them, not just actually services, but also information. With information, these girls and boys are able to make informed decisions. I have some bit of background in medical, and most of the time when these girls come to us, sometimes they don't know what to do. They don't have information about emergency contraception, and as I think some of them are here. She'll have sex because sometimes we don't have control over that because these are feelings and they're natural, But how do we manage them? Yes, so if you laugh, please go on. You can laugh. So the thing is that we may not be able to control our feelings, but how can we control the way we have sex, So do we have information about contraception? How many of us in government in April 2001, the AU Commission and all the governments under AU, they passed a resolution and they said about 15% of every country's budget should go towards health. In Uganda, it has never crossed up to 10. I don't know about here. Maybe Honorable Mbabas can tell us. If it was a ministry kind of health event, I would be asking every minister to tell us what the percentage is in their country. But for us, it's been, I think, about between 6 and 8%. And that was a resolution that was passed about how many years? About 20 years. So with the figures I've just shown you, you can see how much we can actually spend if we invest in the health of young people, not just services, but also information, policies that talk about health. Do we have friendly policies for schools? Do we have teachers or people that speak to young people about health? Do they know what to do? There are so many young people who abort, and it's not because actually they want to abort, but they are just circumstances. As he was saying, mental health. Most of you ladies, you will tell us that even when you're just in your period, you are not mentally fine, You're moody. Now, some of us who are, in my capacity, at least I've had opportunities to be with lovers. But when they are in that period, they will tell you know what, I'm not in the mood. Why? Because they are not in the mood. You get it. So it's very important for us to invest in young people with information, but also the services. I want to mention something. There's something very bad about our healthcare system, and sometimes we have facilities and they are good, but when you walk in these facilities, there are no services. Human resource for health, the ratio is alarming. We don't have healthcare workers, and the population is quite big. So for me, I think I can briefly just share that, but there is a lot to do, and we really, really need to put our monies into the healthcare system and ensure that the girls and boys have information so that they can make decisions, informed decisions. If they want to get pregnant, let them get pregnant when they are well informed than just it being an accident. We are tired of having unwanted pregnancies and unintended pregnancies. Thank you so much.
Wow. Thank you very much to our panelists for sharing and contributing to this conversation. Africa appreciates whatever actions you're doing in your respective communities. Collective action will indeed bring the change and enable us to get to the Africa that we want. So before we take just a few questions, I would like to acknowledge the presence of Mr. Maurice Tayebwa, who is the East African Community Secretariat. Kindly, you can rise up and just say hi to us. And as you do that, I'll just ask you a question, just one quick question, on whether the East Africa community has sexual and reproductive health rights and mental health frameworks to guide its partner states. Welcome, Mr. Maurice.
Yes, thank you so much. Your Excellency, the First Lady, distinguished delegates, and our distinguished panel, thank you so much for the discussions. They were really insightful. And I'll just go straight to answer your question, moderator. Thank you also for the good moderation. Yes, I'm called Maurice from the East African community. I identify as a youth, and I'm in the Social Sectors Directorate, which also deals with youth, children, persons with disabilities, social protection, health, education. It's a whole list. And yes, the ESC has frameworks. First of all, we are guided by the treaty that establishes the ESC as an intergovernmental organization for the 7 countries in the East African region. And this treaty has areas of cooperation. We have areas of cooperation in health and in gender. In health, we have some policies. We have a strategic plan on sexual reproductive health, but also including neonatal and maternal health. And this, unfortunately, has elapsed. It ended in 2021, so we are in its review and developing a second one. We have also a strategic plan, which goes up to 2030. That's on SRHR. But in gender, also we support advocacy at regional level, especially on issues of human rights concerning sexual reproductive health. All of you have heard of the Sexual Reproductive Health Bill, which is currently under discussion in the East African Legislative Assembly. I think we've gone through all the partner states in East Africa to discuss with young people, stakeholders, governments, on how to strengthen the legal framework on sexual reproductive health. But we also have conversations with other regions. The Southern African regions, we have what we call the ISA commitments on sexual reproductive health. And we are in a conversation We are now into the second round. We had a round which elapsed also last year, and we developed new commitments. We revised the old commitments and developed new commitments. And now we are working with partners. UNFPA is here, but other partners, UNAIDS, WHO, and other UN agencies and governments to make sure that these commitments are adopted and implemented within the various frameworks at national level. You've heard of the Maputo Protocol. We work with the African Union to make sure that those elements in the Maputo Protocol that touch sexual reproductive health are domesticated in government programs and policies. And for us, all we do is actually to do a review. And related to that, we've developed a monitoring framework as a scorecard for the implementation of the Maputo Protocol. The issues on mental health are still very silent in policy and programming, and I would have loved the panel to bring that out. Mental health, I think the doctor talked about it not being understood very well conceptually, but also in terms of programming, it's still also not understood. But we work with different stakeholders. We have the regional psychosocial initiative, or psychosocial initiative REPSI, which has developed a community of practice on psychosocial issues and mental health. And this community of practice has academicians, civil society, governments, and we are constantly trying to review how we can better strengthen programming and policy on mental health. So I think I will stop there, and we can engage more. I know at the regional level we could discuss on and on, but thank you. I'm happy to be part of this forum and happy to meet all the youth in the East African region and the African continent. Thank you.
Thank you very much, Mr. Morris. And so we are just about to enter the Q&A session. And I'll just like to open the floor to only 3 burning questions. And so, let me see. So we're going to start with the lady.
I can't even see.
There is there. Kindly state your name, your affiliation, and you can direct the question to the speaker that you would like to answer, the specific question.
Thank you so much. Thank you for this opportunity. My name is Sylvia Mkomwa. I represent Tanzania. And first of all, I would like to congratulate our panelists and also the efforts that are being done by every stakeholder to make sure young people are strong mentally. But I will start by outlining a quote saying, "The early years are important for the experiences that provoke early learning and the relationships that give meaning to those experiences." With the advancement of technology in helping the growth of these young people due to easy access of information, but I believe there is one institution that is yet to be rebuilt in this generation, and that is family as an institution. My question goes to the doctor. All these decisions that we as young people are making or are to make, our biggest foundations are our families, the people that surround us, the people that groom us at home. We're speaking about parents, but at the moment, we leverage technology, digital spaces to get some of the information, including the sexual reproductive health education. And also, how can we leverage our current families as a strong institution for raising strong mental health youth and opposing to our culture that also as a challenge to our family to talk about sexual reproductive health education? How do we go back? How do we enhance their role in our community to make sure that we young people are mentally stable and emotional intelligence stable? Thank you.
Thank you very much. Dr. Crystal, you can go ahead and...
So, thank you very much for your question. It's a very good question. So, you asked about how we can regulate the foundation of a family and enhance sexual and reproductive health and also mental health. And I think with the exposure of young people, as you said, teenagers, adolescents, and the youth to technology, even social medias, so has actually brought an image that a lot of information is there for young people. And the thing is, differentiating that information, which is on social medias, with evidence-based information, is not only in the hands of the government, is not only in the hands of people who brought those social medias, but is also in the hands of the family, as you said, as a foundation. That's why I challenged the young people in the room to find ideas and innovations which actually even bring the family in the picture. Because the culture that we hold on and also the discipline and the principles, we got them from the family. But in the many African families, it's very hard to find a parent and a child sitting nowadays and talking about important matters. And that includes sexual and reproductive health and mental health. That's why I challenged young people to bring innovations which can actually attract young people to get evidence-based information in a friendly and fun, interactive way, but which is safe, like a safe environment where they can get those information. I know it's going to be challenging because it's competing with the other information which is already there, but it's up to us to make it attractive as those other information which are not healthy are. And I also welcome parents in the room to actually know that you have to work together with the government in order to bring upon those information to young people. I liked how it was written on every corner of the room: connect, innovate, and invest. Because connecting, innovating, and investing is not only in the hands of the government, it is in the hands of the families, in the hands of the parents, but most especially in the hands of today and the future. And that's us young people. That's why in Innovation Accelerator Program, I liked how we started as 3 winners, it became 4. It would be nice to have so much more young people encouraged and invested in order to bring upon those innovations. Thank you.
To the second question, I'm gonna give it to a gentleman, the one who has raised both of his hands.
Hello, everybody. My name is Dr. Shoaib Abdullah Hassan from Somalia. This is my 5th time coming to Youth Connect Africa. And just wanted to mention 2 things. This is not a question directed to the panel, but I think it's very important to mention this. We are talking about resilience youth, resilience Africa. So back from home, Somalia, I think we are the most resilient youth there, studying, surviving, and also developing. And I had more girlfriends than having male friends. Why I'm saying this, there are 3 elements I came out that youth need. Number 1, youth need trust. They need the trust to go to a hospital, especially girls from Muslim countries. And I don't know why Youth Connect is not giving more platforms to the Muslim culture or Islamic culture. That is where we have more girls and more, a lot of more. But that's just for a comment. Now they need trust to the doctor, to the gynecologist, or to anybody who's working in the health sector that they can talk to, especially the problem back home or environment. And then people need to engage youth. They need engagement, to listen their stories, to sit with them, to set a good time for them, especially psychology and psychiatric departments, where most of the governments don't put a lot of money, and in Swahili they call Mondo Wazimu. Even a doctor from BHD sitting there, psychology and psychiatric specialist, the one who's supposed to be given the platforms and talk to the people, some society see them is as a doctor for the mentally ill people or for the mentally disabled people. So that culture also should be looked into, and then more of psychological and psychology and psychiatric clips or videos to be played in schools, hospitals, so people interact with these stories behind the mental issues. And the third point is, now, after trusting the youth, both sides, they trust you and you trust their stories, you involve them, you listen to them, then now you engage with them. This means we will have more mental stories to be on place, and then that way I think more of this topic will be covered. Thank you whoever is putting a lot of energy and resources into this chapter. Thank you so much. I just wanted to contribute to that, and thank you everybody.
Thank you very much. And to the last question, I'm going to give a young person on the high table. I want to say the high table. And so, any hands? The lady with striped and a black, I think it's a dress. She needs a microphone.
Hello.
Hello.
My name is Amania from Central African Republic. I will be speaking French because my English is so bad. So, I have one question for Dr. Jean-Pierre. In French, so, comment identifier une personne qui a des problèmes mentaux? Parce qu'on a la majorité des jeunes qui ont des problèmes mentaux, mais qui ne le savent pas. Et quel est votre message pour eux afin de leur motiver d'y aller voir le psychologue? Parce que certaines personnes, elles ont honte d'y aller voir le psy pour dire moi je suis fou et des choses comme ça. Et puis, secondo, qu'est-ce qui vous a poussé à faire dans la médecine beaucoup plus vous spécialiser en santé mentale? Je vous remercie.
You can go ahead, Dr. Pierre.
Thank you so much. I will be answering in English. Do you want to read the question in English first? But I can also answer if that's okay to start by there.
In just a few minutes, you can go ahead.
All right. So how do you identify when someone is going through mental health challenges? That's where we need to start. And I have seen that in different spaces where people feel like, okay, because in most of the time, we meet on the street, in the churches, in the schools, at work, and we are all, most of the time we look like smiling and healthy, but sometimes we have some mental casualties among us, myself, yourself, someone else, but that can't be seen easily, as you can see other injuries most of the time. So, one, identifying someone who is going mental health issues, when it comes to mental health illness disorders, it is something that is only approved or kind of diagnosed by a mental health specialist. However, in terms of the preventive measures, here I'm saying that to make sure that you don't see someone here or on the street or your colleague and say, hey, you are mentally ill. However, we can identify when someone is going through mental health challenges, especially it requires to know that person. So if you know that person, you can start to see that something is changing. The way they behave, the way they react, the relationship with themselves and with others have changed. A few things I'm going to recommend. So first, step number 1, be self-aware. The self-knowledge helps you to know, even sometimes you may not even know that yourself is going through mental health challenges. You may think that is who I am. I'm a bad person. But first step, self-awareness helps you to have self-compassion. Forgive yourself for some mistakes that you may have done because of those mental stresses. So knowing yourself is a step 1 that helps you seek support as well. Know yourself, self-knowledge. You get supported through that step 1. There's also support for that. Self-help. Second, learn how to regulate or cope with your distress. Sometimes these accumulation of stress end up being mental health diseases. Learn how to cope, to regulate the stress. Third,
Hoping it's the
there is
last
a
one.
power in collective healing. The concept of Ubuntu, your wellness depends on my wellness. We need to leverage it in African cultures. Seek mental health support. There's a clinical support in hospitals, health centers, but also those collective spaces. There's also online therapy. If you have a fear of going into those buildings sometimes because of the stigma, online therapies also exist. You are not alone. Thank you.
Thank you very much. And just to conclude on what has been said, financing, innovation, collaboration, and advocacy are key to ensure that we bridge the existing gaps in sexual and reproductive health rights, mental health, and economic empowerment. Thank you very much to our speakers, and peace.